Early pregnancy symptoms, if observed carefully, can help you detect pregnancy within a few days of fertilization. However, most of the women fail to notice some of these pregnancy symptoms, as they can be at times very subtle. These pregnancy symptoms are signals sent by your body to make you aware of the fertilization and development of fetus inside your womb. There are so many ways your body sends you signals as its reactions to drastic hormonal changes taking place inside your body. These reactions include significant changes in both mental and physical health. Most of the expecting mothers assume an overdue period is the first sign to watch out for, and this symptom summons rest of the pregnancy symptoms. However, a missed period is not likely to be the first sign of pregnancy. Rather, a woman might be already few weeks pregnant until she observes her period is overdue. Therefore, you can start keeping notes of all the signs of pregnancy and create your personal pregnancy calendar. You may ask why, but creating a pregnancy journal or a pregnancy calendar is to keep track of each symptom you undergo. Each symptom is potent enough to comprehend a fetus's development inside you. These signals can also make you aware of arousal of any pregnancy complications and help your doctor to take right step. So what to do with pregnancy journal and how does it help me? A pregnancy journal or pregnancy calendar must be updated every week. Take care not to miss a single symptom or advancement that speaks of progress or development of the fetus growing inside. You can also take help of the online weekly pregnancy calendars to keep trace of every stage of fetus's development. Calendars help mothers to make an entry of every sign of pregnancy they notice throughout the 9 months of journey towards childbirth. Making your personal weekly pregnancy calendar is a good way to check the progress of your pregnancy. It is a good idea for detecting pregnancy as you tend to observe every symptom of it, since they arrive gradually. In this regard, a pregnant woman should be aware of the fact that sequence of pregnancy symptoms extensively varies from one woman to another. So if you have not come across a particular symptom, do not start panicking as it may appear later. Sorry about this long intro, but making a journal is the best way to track the symptoms altogether and not remembering them, so you can have all the changes to notify your doctor. Now, what are early pregnancy symptoms and how to determine them? Fatigue. Sudden onset of tiredness is one of the early pregnancy signs and symptoms. Havoc hormonal changes inside your body that supports your baby's development are to blame for this heightened level of tiredness. You may feel like taking a nap now and then, and may make you feel having rest throughout the day. Fainting. You may faint or may undergo sudden feeling of dizziness. As per medical professionals, this is quite normal as the result of low blood pressure disorder caused during pregnancy. Sudden arrival of tiredness and fatigue without any reason after conceiving is a way in which your body alerts you of pregnancy. However, this symptom may disappear after the first trimester of pregnancy and may revive on the third trimester. Fainting or dizziness is caused by lowered blood pressure during pregnancy. If you feel your head is spinning as you try to rise after sitting a while or even fainting, contact your doctor or take a home pregnancy test. Expecting mothers should alleviate loads of works and be cautious while putting your feet up. Spotting or bleeding. Due to implantation of the fertilized egg at the inner walls of the uterus, you might notice light vaginal bleeding in the form of pinkish color. This bleeding accompanies slight abdominal pain. However, heavier pain and bleeding draws medical attention and signal pregnancy complications, so it is best to call your doctor immediately. Don't worry, little bit of bleeding secreted through your vagina is quite normal during the early stage of pregnancy. This spotting is also known as implantation bleeding, as the bleeding is caused by implantation of egg to the inner walls of uterus. This is one of those very common early pregnancy symptoms and occurs a few days after conceiving. After implantation, the fetus starts developing in the uterus. You may notice the color of spotting a bit pinkish, unlike the color of your menstruation. Implantation bleeding may accompany slight cramping pain in abdomen that is quite normal and harmless. However, if the pain is severe, you must consult doctor immediately, as it may signal some complications. Missing your periods. Periods being overdue is what most of the pregnant women consider as the most sure signal of pregnancy. However, there can be other factors that lead to a missed period like stress, travel, etc. Besides, when you notice a delay in your period, you are already 1 or few weeks pregnant. So, the best you can do is to look further for other typical early pregnancy symptoms to confirm your pregnancy. Morning sickness or nausea. Many pregnant women complain about feeling of fatigue and nausea in different time of the day. It can be in the morning, afternoon, evening, or during the night. However, this early pregnancy symptoms are termed as morning sickness. Expecting mothers may reduce discomforts of morning sickness by reducing spicy dishes. Consider cutting down big meals into small frequent meals that are easier to digest, will give you less discomforts of nausea. Tender breasts. If after a few days you start noticing pain in breast along with a little swelling and tenderness, you must consider this as one of the strongest early pregnancy symptoms. Some may observe their veins surrounding chest areas seem highly visible, and the areola tend to become darker in color, along with tender breasts. Let us turn back again on pregnancy journal. Create a pregnancy journal by making a note of all early symptoms before your visit to the doctor. Doctor may take a urine test, blood test or pelvic exam. The pelvic exam is carried out to detect to see if the uterus has been enlarged or if there is any complication. You can also use this journal as a guide on what exercise you should be doing. Many of the early pregnancy symptoms also signal negative pregnancy, such as miscarriages or ectopic pregnancy. In such cases, pelvic exam is the way out to identify it accurately. Let us recap. Some of the most common early pregnancy symptoms are breast tenderness, morning sickness and nausea, pink spotting or bleeding, fatigue and missed period. Whatever you do with your symptoms, it is always best to consult with your doctor. These are most common techniques that you can use to determine if you are pregnant or not. Thank you for watching this video. I wish you a good luck with your life and to take care of your health.